For this movement, you're going to have a foam roller. If you don't have a foam roller, you can use like a paper towel roll, anything that you can just press into the wall that gives you adequate space between the wall and the knee. So you're gonna have the foam roller on the inside of the knee. One leg will be in front and the other leg is just gonna be kickstanded back. You wanna make sure that the foot on the floor is straight and not rotated out to the side. You wanna think about kind of bending that front knee just slightly, and most of your weight is through the front leg. I want you to think about pushing your knee into the foam roller to keep that foam roller stabilized into the wall the whole time. And you want to make sure that that weight in your foot is through that tripod stance. So you're thinking big toe, little toe, heel, with a little bit of an emphasis more on the inside of the foot. So our pelvis is going to be pretty much in that square position. As we go into a little bit of a hinge, we want to think about lengthening through our glute muscle here, that posterior hip. And at the same time, you're still pressing that knee into the wall. As you're doing that, you should feel, and you press into the wall, you should feel space created into this backside. Now, this doesn't feel like, oh, this really relaxing stretch. It will feel like work in a lengthened position. So as you're holding that, you're starting to feel a little bit of a burn here. If you feel all hamstrings, you need to just bend your knee a little bit more. As you think about holding that position, you're then going to rotate your pelvis. So think pelvis on the inside, rotating towards the front thigh. Okay, so this is the only thing that's moving. Sometimes I have people reach their arm to the opposite corner of the room to try to get a little bit of rotation as well. Just make sure that that rotation is stemming from your pelvis and not just rotating from your chest. Okay, we want that whole trunk to be coming with you. Again, still anchoring through that full foot and still pressing that knee into the wall, and you will feel that backside light up. You're gonna take a nice inhale into that backside. Exhale, push the floor away, back up to stand. As you get used to this movement pattern, you can take it into a little bit of a quicker movement where we're inhaling as we rotate down. Exhale, come back up. But if you have trouble, you're finding that glute muscle in that lengthened, internally rotated position, which is super helpful and difficult for a lot of people to find.